Hello, class. This is Megan. We're going to talk about the pain management of the burned patient. Some learning objectives. At the end of this learning experience, the student will be able to identify 3 common medications used to treat acute pain, evaluate the patient's respiratory status after medication administration, and compare the different available medications for pain and anxiety management. So let's start with a review. Burns are staged by the depth of the injury. Pain is dependent on that depth of burn, and treatment changes depending on the degree of injury. But keep in mind, pain is subjective. If your patient says that they are in pain, believe them. Burns are very painful. So these are the common medication classes that are used in burn management: nonsteroidal anti-inflammatory drugs, or NSAIDs, opioid medications, and the benzodiazepine class. So NSAIDs. These are very common. They're over the counter. Stuff like Tylenol, ibuprofen, and aspirin are used for the inflammation process. To begin with opioids, we'll start with hydromorphone hydrochloride, commonly known as Dilaudid. This is an opioid analgesic, and it is used as the first line of treatment for the pain of a burned patient. This is a very sedating medication, so monitoring the respiratory status is going to be very important. That's going to include respiratory rate, oxygen saturation, and the color of the patient's skin is also important. Next is fentanyl citrate, or commonly known as just fentanyl. This is also an opioid analgesic. It's considered to be the second line after Dilaudid. It is also a very sedating medication, and you should also monitor the respiratory status, again, being respiratory rate, oxygen saturation, and the patient's coloring of their skin. Keep in mind this is a very short half-life of this medication, so they may need a lot of it frequently. Third is morphine sulfate, or just morphine. Again, it is an opioid analgesic. It's not as commonly used in the burn patient, typically as a third line drug or a combination of more opioid medications. And again, it is also sedating, so please monitor their respiratory status. Again, having to do with oxygen saturation, respiratory rate, and the coloring of the patient's skin. Some patients may require a patient-controlled analgesia, or a PCA. This is a medication given via syringe through a pump, of which the patient has their own button that can give themselves their own medication. Benzodiazepines, or just benzos, are things like lorazepam, or Ativan, or diazepam, or Valium. These are typically used as anxiety medications, or anxiolytics. This is going to help the patient while they do their burn care, ambulation, or just in some sort of conjunction with their pain medication, because being burned can make somebody very anxious, and this will be helpful with the patient for their pain management as well. Some nursing considerations to keep in mind. Patient comfort and the pain experience is very important, and in a high-risk environment like this, these are things to keep in mind. These are strong medications, so there's a high risk for adverse effects. An example, their respiratory status. The respiratory status needs to be assessed and documented, because remember, if you didn't document it, it didn't happen. Advocating for your patient is going to be very important, especially if they seem like their pain is not in control, and suggest a PCA where appropriate. I thank you very much for taking your time to review the management of the burned patient and their pain experience. This is something that is very important and will help your patient grossly in their long-term management of their burn care. I hope you enjoyed it.